So this video is going to teach you how to instill eye drops. We're going to work on the gantries and eye drops from Jack's MAR. First thing we want to make sure is that our area is clean, our hands have been washed, and that we have the correct individual. Jack, can you give me your full name and birthday, please?
Yeah, Jack Armstrong, April 23rd, 1956.
With that, I'm going to go unlock the medication cabinet and retrieve Jack's eye drops. Like with the other medications, we're going to do their 3 checks. We have medication for Jack Armstrong here. Jack Armstrong, gantricin eye drops. Instill 2 drops into right eye 3 times a day for 3 days. Jack Armstrong, gantricin eye drops. Instill 2 drops into right eye 3 times a day for 3 days. That's our first check. Our second check is out of the box. We have the gantricin eye drops. Instill 2 drops into right eye 3 times a day for 3 days. This is for Jack Armstrong. The time is 8:30 in the morning. It is currently 8:30 in the morning. Jack Armstrong, gantricin eye drops. Instill 2 drops into right eye 3 times a day for 3 days. Okay. At this time, we're going to go ahead and don gloves. And the reason for that is because we need to inspect the bottle. For eye drops, we want to make sure that there's no crack or opening in the medication bottle. We want to make sure it's not leaking. If it is leaking or there is a crack in the bottle, the medication could be contaminated. We need to contact the pharmacy immediately and not give that medication at the time. So we're going to do our third check. This time we're going to make sure that the medication that was inside the box, both labels, and the MAR all match. So we have Jack Armstrong, gantricin eye drops, instill 2 drops into right eye 3 times a day for 3 days, 8:30 a.m. Jack Armstrong, gantricin eye drops, instill 2 drops into right eye 3 times a day for 3 days. And again, Jack Armstrong's gantricin eye drops, instill 2 drops into right eye 3 times a day for 3 days. We remove the top. We want to make sure we don't put the top on a surface that could contaminate the top. We're going to inspect here. If this needs to be cleaned, we are going to clean this off with a sterile gauze. Remove our gloves, wash our hands, put new gloves on, and then proceed. We also want to check and make sure Jack's eyes are clean. If Jack's eyes appear to be dirty, we're going to start at the inner cannulas and work our way to the outer cannulas with a sterile gauze and just plain water. We don't want to use soap in the eyes. This is going to involve a fourth check. Fourth check is unique to eye drops and ear drops and various other things that might be determined based on the person's right or left. Jack, it is okay if I stand behind you so I can verify that I have the correct eye before I give you your drops?
Yeah.
I'm going to step behind Jack. I'm going to verify that we're using his right eye. So right hand, this would be his right eye. Again, we have Jack Armstrong, we have his eye drops, we have his right eye, and we need to go 2 drops into his right eye. We want to verify that we know how many drops we're going to do here on the fourth check. Jack, is it okay if I apply or instill your eye drops?
Yes.
So I'm going to pull down on his lower eyelid to make a pocket. We're going to do 2 drops. 1. Careful not to touch his eye with the tip of the thing. This time you would want to provide him a tissue and have him blink gently so he doesn't lose his eye drops. And then he can sit upright. We're going to recap his medication. We can remove our gloves, wash our hands, and document. Don't forget that we're going to observe, record, and report the effects of the medication.